Hi, I am Briley Kuda from BSN1H, and for this video, we will be talking about Coronavirus Part 2. We understand that individual accountability and commitment to following health recommendations are critical to our success. To limit the risk of COVID-19 exposure and dissemination, certain steps will be required. To protect ourselves from the virus, we must put these personal safety practices into effect. First, do social distancing. Keeping a safe distance between yourself and other people. People can transfer the virus even if they are not sick or aware that they are already affected. Therefore, it is crucial to keep a safe distance from people at all times, even if they do not show any symptoms. Always remember to keep at least a distance of 3 feet between yourself and others and stay away from crowds and poorly ventilated areas. Number 2. Make use of face masks. Wearing a mask that provides you with the optimum fit, protection, and comfort, because the virus can spread by small liquid particles. When an infected person coughs, sneezes, speaks, sings, or breathes, these particles range in size from larger respiratory droplets to smaller aerosols. Number 3. Maintaining proper hand hygiene. One of the most critical steps people may take to avoid the transmission of COVID-19 is to wash their hands often. Hand washing should be done after handling something in a public place, using the restroom, before eating, and touching anything or blowing one's nose. The proper way to wash your hands is as follows. First, you should wet your hands, then apply soap, then rub them together vigorously for at least 20 seconds. Make sure to clean between your fingers and under your fingernails. When a paper towel is available, use it to dry your hands after properly rinsing them. When leaving a public restroom, use the same paper towel to turn off the water and turn the door handle. If you don't have a paper towel, turn off the faucet with your elbow and turn the door to depart the restroom. If a soap and water aren't accessible, rub your hands with a hand sanitizer containing at least 60% alcohol until they're dry. Number 4. Get vaccinated and keep your COVID-19 vaccinations up to date. COVID-19 immunizations work well to keep you from getting sick. COVID-19 vaccines are extremely effective in reducing serious diseases, hospitalization, and death. Number 5. Sanitize and disinfect. Clean high-touch surfaces on a regular basis or as needed, especially if you have visitors. Disinfect commonly touched surfaces if someone is unwell or has tested positive for COVID-19. Prior to disinfection, clean surfaces with detergent or soap and water if they are unclean. Number 6. Keep a daily watch on your health. Be aware of the following signs and symptoms. COVID-19 symptoms include fever, cough, and shortness of breath. If symptoms appear, immediately take your temperature. Number 7. Conduct a test to ensure that the disease does not spread to others. SARS-CoV-2 tests determine whether you are infected at the time of the test because it checks for viral infection. This type of test is termed as a viral test. A positive test result, regardless of the test type, indicates that you have an infection and that you should isolate and tell your close contacts to avoid transmitting sickness to others. COVID-19 self-tests are one of the many risk reduction techniques that safeguard you and others by minimizing the likelihood of COVID-19 spreading, such as immunization, masking, and physical separation. Stay at home. Isolation and quarantine should be followed according to the recommendations. If you come into close contact with someone who has COVID-19 or if you become ill as a result of it, quarantine and isolation should be followed for 10 days after your last close encounter with someone who has COVID-19. Physical distance, frequent hand washing, cough or sneeze etiquette, correct tissue usage and disposal, avoidance of touching one's face, adherence to quarantine or isolation regulations, and respecting others are all personal responsibilities. Thank you for watching and have a good day.